I think this meeting is a festival of immunotherapies, a festival of bispecific antibodies, a festival of cellular therapies. And so there are many questions which pop up when you use, for instance, bispecific antibodies, when you combine bispecific antibodies with different epitopes. We have studies which show an extremely high response rate. The question is, how durable are these responses? How long should treatment be administered? And what about the tolerance of the individual patient? And what about the risk for infections? So what we have to learn is to better prepare our patients in terms of immune response to microbia, viruses, bacteria, and so on. And also when we use, for instance, IVG, intravenous immunoglobulins, the question is whether we should vaccinate the plasma donors, for instance, against herpes, viruses, and so on, and pneumococci, in order to have a product which at least covers the antigens where we have good vaccines available. So I think that could also improve the treatment efficacy of intravenous immunoglobulins, but it's not an easy task. And when it comes to CAR T cells, of course, there are many questions. So one of the questions is, of course, what can be done by modulating the receptors. And we have an excellent example, for instance, the Silter cell CAR T cells. They have two binding sites, two targets on the BCMA molecule, and seem to be particularly efficient. And then, if you are highly efficient, we have to acknowledge that myeloma clones follow Darwinian pathways and quite frequently develop a clonal evolution with new clones which don't carry the targets which have been targeted by the bispecific antibodies or by the CAR T cells. So this means that we need to probably, for those patients, use other targets, and maybe targeting multiple epitopes on the myeloma cell will be the way to go in the future.